We should now move to the second presentation. The title is from the Surgeons Registry, Dr. Hayri, Meriç, Urological Surgeries, and their results performed in Gaziantep Hometown Hospital in 1949. It will be presented by Ömer Bayrak and co-authors Özcan, Sevim, Samet, Bayrak, and Ayşe, Balat.
I'm Özcan, Sevim. I work in Gaziantep University Department of Urology as a research assistant. I want to thank you so much, Professor Dr. Ayşe Balat, for giving me this opportunity for this presentation. I will tell you today from a surgeon's registry, Dr. Hayri, urological surgeries and their results performed in Gaziantep Hometown Hospital in 1949. Gaziantep Hometown Hospital was the first official state hospital that started to serve in Gaziantep after the establishment of the Turkish Republic. It started to operate in 1927 under the special administration. In this study, we aim to present the urological surgeries performed in 1949 and their results recorded by Dr. Hayri Meriç. On the left, picture of Dr. Hayri Meriç, and on the right, picture of Hometown Hospital. We examined the 64-page brochure written by Dr. Hayri Meriç and published by Halk Express in Gaziantep in 1950 was analyzed. In this brochure, it stated that he started to work as a single surgeon in the hospital on November 30, 1948, and was the chief physician of the hospital since May 30, 1949. In the light of the information presented by him, the number of patients admitted to the surgical clinic, how many urological operations were performed, which pathological causes played a role in urological surgeries, how the operations had resulted were recorded. It has been reported that a total of 738 patients were hospitalized in the clinic, surgical clinic of Gaziantep Hometown Hospital. Of 473, 439 were cured, approximately 90%. 5 patients recovered, 6 patients were discharged, and 23 patients died. Operative procedures were performed in 49, approximately 10% of 473 patients due to urological pathologies in the surgery service. Urological pathologies are including testicular diseases, prostate enlargement, bladder stone, bladder papilloma, urinary tract structure, urinary tract stone, kidney trauma, vesicorectal fistula, penile deformity, and circumcision. There are a number of patients and surgical procedures which is done, number of patients and outcomes of the surgeries. 48 of the urological interventions resulted in a cure, and 1 patient resulted in death diagnosed with prostate enlargement. In his records, he also mentions hospital-related problems, and he emphasized the importance of correct communication between physicians and patients. Operator Dr. Hayri Meriç stated that since the hospital was served, a clinic protocol book has not been kept, so a comparison with previous years couldn't be made. The data presented by author for that years was one of the first official records to the best of our knowledge. The situation reveals to us how valuable the proper keeping of medical records is in terms of transferring information to future generations. Operator Dr. Hayri Meriç requests physicians asking for the current period not to refer patients they see in the practice, examined at home, family patient, to the hospital hospital with a paper stating that he needs to be treated by being hospitalized. In addition, he states that physicians should guide the patients, telling them firstly to apply to primary polyclinic, even if there is a need for hospitalization, and reminding them the on-call doctor is really rare in case of emergency. As a reason, he expresses himself to be under great sadness and embarrassment when clinic chef or the on-call doctor is unable to hospitalize the patient. He also draws attention to the fact that the clinic chef or the on-call doctor remains in a difficult situation for not fulfilling rightful desire of the physician who sent the patient. It's also emphasized that this situation causes the clinic chef or the on-call doctor to be unfairly exposed to unpleasant words by the patients and their relatives whose desire for hospitalization could not have been fulfilled. In the notes in the book, it's seen that the number of beds Gaziantep Memleket Hospital, which was 75 in 1949, increased to 100. In the author's note, the hospital has been working with 8 doctors and 5 nurses, an unprecedented numbers since its establishment. The fact that at least 3-4 times more doctors were in a 100-beds hospital today is one of the most important indicators of how devotedly the physicians work under the conditions of that time. We cannot be grateful enough to the physicians who worked in the past for their hard working and giving a lead to us. In addition, the successful implementation of urological surgeries by a single surgeon in the challenging conditions of the period is admirable. He was a surgeon being a role model to his colleagues by showing how valuable the proper keeping of medical records is in terms of transferring information to future generations and emphasizing the importance of patients, physicians, and inter-physicians communication. Thank you all.
Thank you very much for a very interesting presentation. Do you have a question? Yes, please, Mr. Gaspar.
Enjoyable day. By the time you will send the manuscript for the publication, it would be appropriate to know the territory, the number of inhabitants, how the people in the hospital serve, and this would help to understand. Also, if he was able to attract people from other territories. Thank you.
He's one of the important names in Gaziantep, and he struggled with a lot of problems but made a lot of surgery, and we found the published book of him, talked with his grandchildren, take the data, and we would like to share it because most of us still have the same problem with inter-physician relationships and patient-to-physician relationships. Thank you. Thank you so much.